Let's look at a couple of different head injuries. The first one we're going to talk about is concussion. Concussion is a jarring of the brain, and that just means they've had some bit of a slight hit or something, a brief unconsciousness, disorientation, dizzy and blurry vision. So it will be quite obvious that they've had something happen to their brain from maybe they fell and hit their head or they had a contact sport injury. We will watch for increased ICP, and we will instruct the family to look for the signs and symptoms. Vomiting, disorientation, changes in their level of consciousness, sleepiness, that's unusual, gait disturbances, speech problems. So anything, problems with walking or talking, they need to come see us. Now, repetitive concussions can be a severe problem. So chronic traumatic encephalopathy is called CTE, is a sports-related type disease, and it is from repeated concussions. It does increase the risk for dementia, Parkinson's, and Alzheimer's disease. I've even seen people as young as 30 years old have CTE and have developed some dementia and memory loss. So it's very important that when your client is taking a contact sport, that they take precautions to prevent concussions. And that's why a lot of times you'll see in grade school type age groups with their sports like football, they're not allowed to do full tackle, or head-to-head contact is a big no-no in even NFL and higher up level type college age football sports stuff. A contusion is different than a concussion because a contusion is a brain bruise. So there's bruising on the brain. When you have a bruise, you can have bleeding, edema, swelling, inflammation. When it's a direct hit, that's called a coup injury. So maybe they had a car accident and they hit their head on the steering wheel. That's a coup injury, direct hit. However, when the brain ricochets back from the force of that, that becomes a counter coup injury. So that's when the brain has had so much force that it bounces off the front of the skull and hits the back of the skull. So the direct hit is coup, and contra coup is when the brain hits the other side of the skull from the pressure. They will have edema. They can have a skull fracture. They're going to show signs of shock. So hypotension, tachycardia, that's a weak rapid pulse, and then low respiratory rate. Pale and clammy skin. They can black out completely and have amnesia. They may not know what happened to them. They can also have brain damage from a contusion.